I'm Dr. Rick Green, Senior Medical Editor of General Surgery News, and we're coming to you today from Charlotte, North Carolina, and the 87th annual meeting of the Southeastern Surgical Congress. And it's my great pleasure to be with Dr. Raj Parikh, fourth-year surgical resident at New Hanover Regional Medical Center.
Thank you so much for having me, Dr. Green.
Thank you very much. Now, I know you've presented at the meeting.
Yes,
tell us a little about your presentations.
Yeah, so we have two pediatric surgeons that we work with, and we had a couple of really interesting cases. We had a 3-month-old that had developed tension pneumoperitoneum after attempted pneumatic reduction for intussusception that we emergently took to the OR and got fixed up, and she's doing really well. And then we had another patient, a 3-year-old, that was ejected from an ATV after they had come into an accident and had a traumatic right upper lobe bronchus avulsion that needed emergent repair. And so they were very interesting cases and could have had very bad outcomes, and both the kids did great. And so they were, wins for their families and for the hospital, and I think interesting cases to present to the community here.
So your 4th year, you're thinking about what to do in life after general surgical residency, and what are your thoughts?
I'm applying for vascular surgery right now.
And as I understand it, you want to do 5 years of general surgery?
Yes, sir.
And then 2 years of vascular?
Yes, sir. It's been a lot of fun so far, so I don't want it to end just yet.
That's wonderful. So and that's great, because we know that there are mixed programs now in vascular.
There are, yes.
And so I salute you for doing that. How do you decide where to apply these days?
So I think a lot of it we have many residents that have gone into vascular surgery, so I feel very lucky to have a lot of mentors in that sense that have gone to a lot of the programs and gave me some feedback from their interview trail. And so I ended up basing a lot of my selection of application based on their recommendations.
So what are you planning for the 2020 meeting in New Orleans? What would you like to present next year?
I know, we were actually talking about it because obviously we have to come, it'll be our last year of training, and so I got to get something in the works. I'm working on a project right now with our trauma attendings on the FAST exams, and so we have our AirLink that are performing FAST exams in the helicopter, and so we're trying to assess their ability to utilize the ultrasound and our ability to utilize the ultrasound, and if those things are correlating. Ideally, if we see that we're both getting the same results and these patients need to go to the operating room emergently if they're hemodynamically unstable, then potentially we can take them straight from the helicopter to the operating room instead of having the time lapse in the trauma bay. So I'm working on that project right now, and hopefully should be ready for the next meeting.
Well, I want to congratulate you on a wonderful surgical career, and I want to say I'm sure you're going to be an excellent vascular surgeon.
Thank
We've
you
been
so much.
talking with Dr. Raj Parikh, a 4th-year resident at New Hanover Regional Medical Center, who made 2 beautiful presentations here at the 87th annual meeting of the Southeastern Surgical Congress. Thanks, Raj.
Thank you very much.